Bonjour à tous, dear colleague, hello everybody. Obviously, I would be very happy to be with you in Denver. Unfortunately, it was not possible and I am in Nice and it's not so bad. So during this presentation, we will try with Valernea Manera to define apathy, to look at the interaction with other conditions, and to present the apathy diagnostic criteria presented from 1990 till 2021. And finally, to have some consideration concerning the best way to use it in clinical practice. Now, let's focus on the slides. And first, to remember that the word apathy has been used with different meanings. In the modern medicine, it was Robert Marin in 1990 who discussed first the definition of apathy. Apathy was essentially associated with two concepts, motivation and goal-directed behavior. Between 1990 and 2006, it is the concept of motivation that is most often associated with apathy. From 2006 appear with the article of Dubois and Levy the association between apathy and the concept of goal-directed behavior or activity as mentioned in the last definition of 2020. Other clinical manifestations are close to apathy, which has led to overlap in particular with anhedonia and Masoud Hussein recent article tried to distinguish the two concepts, but also with negative symptoms, which is mostly used in the schizophrenic disorder, with abulia, fatigue, or with depression. And it is understood now that some symptoms of apathy are shared with those observed in depression. With this in mind, let's move now to the presentation of the diagnostic criteria. Following Marin, the first proposal was the fruit of the work of Sergio Starkstein, associated with Albert Legion, in a succession of articles between 2000 and 2008. Four criteria. Criterion A, presenting apathy as a lack of motivation. Criterion B, defining the different clinical domains of apathy. Criterion C, indicating that the symptoms cause significant impairment. And finally, criterion D, excluding several possible other causes. The second proposal, initiated by the European Association of Psychiatry, with the participation of Sergio Starkstein and other international colleagues, resumed more or less the same structure. One of the principal characteristics of this criteria was that change in the three clinical domains, behavior, cognition, and emotion, could be observed and measured by examining a patient responsiveness to internal or external stimuli. This second proposal has been validated in several types of pathology and in clinical practice. In 2018, the third proposal came from an international consensus group including representatives of ISTCM and ISTART. The first characteristic of this criteria is to propose a new distribution of the clinical dimension. The first dimension regroups cognition and behavior. The second dimension is for the emotion, and finally appear in the third dimension the social interactions. As illustrated on this slide, the second characteristic is to give for each of the clinical dimension example, allowing the clinician to easily use the criteria. The match with the 209 criteria was good. A survey in elderly people referred to specialized memory center allowed to define the frequency of apathy in different clinical conditions, including neurocognitive disorder and affective disorder. Dimension B1 showed the highest sensitivity, meaning that its presence was strongly associated with the presence of full apathy diagnostic criteria. The most recent proposal of criteria come from an international academia, industry and regulatory expert apathy work group. And really thanks to Krista Longtot and David Miller for the organization of the process, including literature review, survey and international meeting. The first new characteristic is found in the criterion A, which delimits in a very pragmatic way the fields of application of the criteria to neurocognitive disorders. The second characteristic is a return to the more classic dimensions of behavior, cognition, and emotion, presented as in the apathy inventory, by highlighting the impact on initiative, interest, and emotions. The effect on social interaction is still present, but illustrated within each of the clinical dimensions. Why so many attempts to diagnose apathy? Because it is one of the most frequent symptoms and because it is time to validate pharmacological and non-pharmacological intervention. What use would it be to maintain cognition without interest, initiative or emotion? It is in this context that the interaction between the diagnostic criteria and the assessment instruments is very important. This is illustrated in this slide for the temporal interaction between the development of scales and diagnostic criteria. This is true for the full neuropsychiatric scale, like the NPI or the NBI, but also for the scale specific to apathy. From the 208 criteria, a new trend also emerged concerning the assessment of apathy using new technologies. This is illustrated on this slide with the interest game, which allows to evaluate the number of interests of a subject in a simple and objective way. Audio sensors have also shown good results in the context of apathy, and it's likely that these new technologies will be more and more help in the future. To summarize, with the different diagnostic criteria of apathy, several populations have been targeted. All neuropsychiatric disorder or brain disorder, and then more specifically neurocognitive disorder. The criteria also try to describe the clinical dimension as best as possible. 2021 and beyond, what are the next steps? First, this is the operationalization of the diagnostic criteria and the relation with the previous criteria. It is also important to look at the disease specificity. And finally, always remember that the important point is the implication for the development or the validation of pharmacological and non-pharmacological interventions. This presentation, I would like to thank all the clinicians and researchers who are working on apathy for so many years. I would also like to thank all the patients and caregivers who participated to all the study which has been presented here. Merci à vous, à bientôt, goodbye.